If you're watching this, remember one thing. When it comes to stroke, minutes matter, and seconds can save a life. I've seen outcomes change because someone recognized the signs and called fast. I'm an ER nurse. I've cared for stroke patients at 3 a.m., in crowded waiting rooms, and in silent living rooms where a family member dialed 911 just in time. I'm here to make this simple, so you never hesitate. Here's how to spot a stroke using FAST. Say it with me so it sticks. F. Face drooping. Ask the person to smile. Does one side droop? It can be obvious, or so subtle you only notice a slight pull at the corner of the mouth or an uneven blink. A. Arm weakness. Ask them to raise both arms to shoulder height. Does one arm drift down, feel heavy, or not move at all? Weakness or numbness on one side is a red flag. S. Slurred speech. Have them repeat a simple sentence. Today is a good day. Listen for slurring, wrong words, or inability to speak. If it sounds off to you, it is off. T. Time is brain. Every minute, brain cells die. Don't drive them yourself. Call emergency services. Paramedics alert the hospital so treatment starts the moment you arrive. Now, stroke doesn't always shout. Sometimes it whispers. Watch for these subtle symptoms. Sudden dizziness or loss of balance, like the room tilts or your legs won't cooperate. Sudden confusion, trouble understanding, or a blank stare when you ask a simple question. Sudden severe headache, the worst of their life, especially with nausea or vision changes. Sudden vision problems in one or both eyes. Double vision, a dark curtain, or missing half the scene. Sudden numbness or tingling on one side of the body, even if strength seems normal. Here's the rule. Sudden equals suspect. If a symptom appears out of nowhere, think stroke until proven otherwise. Timing matters. Some strokes can be treated with clot-busting medication, but only within a narrow window, often 3 to 4.5 hours from the first symptom. Certain procedures to remove clots also depend on time. Waiting to see if it gets better costs irreplaceable brain function. What to do right now if you suspect a stroke. Call emergency services immediately. Note the exact time symptoms started, or when the person was last known normal. Keep them safe and seated or lying on their side if nauseated. Don't give food, drink, or medicine unless directed by a professional. Unlock the door, gather their medications or a list, and bring ID. Common pushbacks I hear. They're too young, it's probably stress. Let's wait. Stroke can hit young adults. Stress doesn't cause one-sided weakness or slurred speech. Waiting turns treatable into permanent. Remember, FAST. Face drooping, arm weakness, slurred speech. Time is brain. If you notice even one, act. I've seen people walk out of the hospital because someone made the call right away. I've also seen the opposite. Don't gamble with a brain. If this helped you, share it with someone you love. Subscribe for life-saving health tips and keep FAST in your pocket. You might be the reason someone gets a second chance.